This shows that the survival of lupus has not really improved all that much in the last 30 years. Between 1950 and 1979, about half of the people with organ-threatening lupus were not with us in 15 years, 2/3 with nephritis not with us in 15 years, but this has greatly improved so that between 1980 and 1992, from a study at the Mayo Clinic, about 90% with non-organ threatening disease lived 20 years and about a third less with organ threatening disease. However, it really has not improved since. Work from Sue Manzi in Pittsburgh years ago showed that women were at risk for myocardial infarctions more than 50 times greater in women in their childbearing years. And this is one of the major causes of death, morbidity, mortality in younger women. About a third of all patients with lupus are disabled at 5 years, and about a third are such that they have had to change their job description. For example, if they're out in the sun a lot, they might have to have an indoor job. If they have a occupation that requires a lot of typing or use of the hands, it might require a different job descriptions. Jim McGuire, who was head of rheumatology at Stanford years ago, had a great line, and that was, lupus patients are not disabled. Lupus patients are differently abled. And a lot of the focus is to try, that Dr. Sandhu and Dr. Fury are going to talk about, is how can we maximize their ability to work and be able so that they can function in society, because work loss leads to loss of independence, socialization skills, depression, anxiety, a 50% divorce rate for those with organ-threatening disease in the first few years. And organ damage accrual rates have not decreased substantially since the 1990s. And more than 40% of patients with lupus in each cohort accrued organ damage over a mean of 3 years. So damage indices have been evolved. Damage indices are currently being revised, but it is really one of the keys that fibrosis or irreversible damage or scarring has not really improved, which is why some of the medications that Dr. Fury is going to talk about are so important.